How many papers am I going to get?
Depends on how many A's you get.
Or imagine the IRS. Instead of saying April 15th is the due date for your income tax, pay it when you're ready. That's not a bad idea, really, is it? I could live with that. So anyway, point being, you have to have a time limit, you have to have a deadline, or nothing happens. And if you're going to hold somebody accountable, and if I'm elected, I want you to hold me accountable. And if 5 years from now, I haven't been doing everything I can to balance the budget within 5 years, you should come to me and say, Quist, you have failed. But if I don't put a time limit, I can say, hey, give me time. Rome wasn't built in a day, right? You have to have a time limit. And on top of that, we don't have time to waste. And the longer we wait, the more difficult it's going to be. We don't have time to waste. We have to do it. We have to do it now. We have to set a limit. We can only spend this much in this year. And one body of government, just the House by itself, can put a limit on how much is spent each year. If it's courageous, shows some good leadership, and says we are not going to spend more than this. And so don't ask us to sign on to bills that are going to go above that level. Believe it or not, this is how it's done in the state of Minnesota. And of course, the state of Minnesota has to, because by the Constitution, we have to balance the budget. But in fact, a limit is set and then you prioritize. We have to bring that same method, procedure. It is a matter of procedure. We have to bring that to Washington. So the debt crisis, I'm convinced, is the big issue. By the way, Social Security is definitely threatened by out-of-control debt. Veterans benefits are definitely threatened. National security. Can you have a strong national defense if your economy is heading towards collapse? Of course you can't. Are we going to be able to meet our responsibilities, our obligations to Social Security, Medicare, and veterans benefits if we're heading towards collapse? I'll tell you, Greece isn't meeting their obligations. They don't have the money. So in order to run a good ship, I mean, this is so obvious, isn't it? It's just amazing to me. This debt, this is Banana Republic type of economics. That's what it is. This is absolutely bizarre. I mean, give me a CEO that's going to report to the board with this kind of debt and say, ho hum. That CEO knows, I mean, it's out the door. I mean, you are not going to be there. There's no board that's going to keep that CEO on. And I know I'm stating the obvious, but it's just amazing that we have allowed this to happen. This is not just a difference of opinion. This is a matter of living in the real world versus living in fantasy or just totally shirking a responsibility. It's not just a difference of opinion. It's much more than that. So anyway, that's where I'm coming from. That's why I'm here. It's the only reason I'm here. This is why I decided to come out of working behind the scenes, which I've done for 12 years, to become a candidate, because we absolutely have to solve this. The nature of what the United States of America is requires that we get a handle on this. And I say that means we balance the budget in 5 years or less. Your questions? Yes?
So why do you think there are more people on disability? You mentioned that there are more people that are on disability.
Yes. Yes. But before I say anything about that, let me say what I try to concentrate on is what's happening, how we can change it. As soon as you ask the question why, then all I can do is give you an opinion rather than information. Okay? And so it's a different, I just want you to recognize that this is not a question I can answer with information. But it would appear that it's related to the fact that people can't find work. What are they going to do? Okay, now I say it would appear, I'm giving you an opinion, I can't prove that, but it would appear to relate it. Just the correlation in numbers, where you have more people, not a lot more, but more people going on disability than you have taking new employment, suggests that it's related to the fact that people can't find work. I mean, how are they going to provide for themselves?
Yeah.
You know. But I want to clarify, I like to answer questions if I can with information, and this is an opinion answer, and I'm not going to go to the wall. And if somebody says, well, I've got information to the contrary, I would be happy to hear it. But clearly it's a red flag.
Yeah. Well, to me it seems like, well, the problem is that these people can't, there are people in the United States that have a hard time trying to find employment, and they've been trying to find employment for a very long time.
Right. Yes.
And it seems like Obama is just making light of it, saying that, well, we just need to tweak something, and then all of a sudden people will start finding employment. But there's got to be some root of some problem someplace that's causing something not to work.
Right. Well, let me comment on that. Causing something not to work. I think it's quite clear we've got way too much weight on the sled. Mm-hmm. And you can tweak that weight if you want to. It's not going to make any difference. Mm-hmm. It's not going to make any difference. You've got too much weight on the sled. Mm-hmm. The engine of free enterprise can only carry so much. And as you increase what you're carrying, you lock in high unemployment and the like. Let me give a fact on that, which is significant. Up until about 2003 or so, the federal government, federal spending amounted to 18% of our gross domestic product. Today it's 24%. And for years it was about 18%. 20 years, 25, I can't tell you exactly, but for years it was 18%. It went up to 24%, and that's when our debt starts to skyrocket. And I believe part of the fruit of that is high unemployment and less opportunity. Now, let me give a real-life personal example. I have a very, very, very close friend whom I just happened to talk to about 2 days ago, who has told me several times he, because of medical conditions he has, could go on disability anytime he wants. He has chosen not to. What does he do? He paints houses. He painted my house, and he's very good, and I was happy to give him employment. He shovels sidewalks. He's got a snowblower in the winter. He does whatever he can do. And his attitude is, I am not going to go on disability even though I could, because I can provide for himself. Now, he works at it. He works at it very, very hard. What if he couldn't get that painting job? What if he couldn't get that snow shoveling job? What are his choices? And I'm very thankful that he has chosen what I think is the right one. But I'm going to raise the question too, should we be advertising, encouraging people to go on food stamps? If they're doing fine on their own, why should we get them on a government program? I just fail to see that that is good policy. I mean, I think food stamps are fine, wonderful for people that need them. But if you're doing fine, do fine. And if you can be self-sufficient, be self-sufficient. Yes?
I've heard, talk to me or?
Yeah, go ahead.
Okay. I've heard that some people have sent out hundreds of resumes, and this is what I've heard on the news on TV, and,
right.
And they haven't heard anything from those resumes. So, I mean,
what are they going to do?
Yeah, right. So then, if there's, let's say, 100,000 other people
mm-hmm.
in the United States that are doing the same thing,
right?
And they have different levels of education. Let's say somebody was an executive officer in a major corporation,
right?
And they end up working at a McDonald's, you know.
Exactly. Let me say more about Australia, because as I mentioned, Australia in the last quarter had a growth rate of over 5%. Ours was less than 2%. Australia is doing 3 things differently than we are doing. And Australia, about 15 years ago, put together an economic development plan that focused on 3 things. And as I say that, let me also mention that insofar as the United States of America is concerned, it's not that we have a poor economic development plan. We don't have an economic development plan. There is no plan. And one of my objectives as a congressman is to help put together an economic development plan. Now, I'm not talking about something like what China does in terms of central planning. I'm not talking about that, obviously. But there are a lot of things that government policy can do to encourage economic growth. Okay, here's what Australia did. They did 3 things. Number 1, Australia decided that as a country, they could not spend more than what they had, which is pretty obvious. Now, they haven't met that objective totally, but they've done much better than us. The Australian national debt is 22% of their GDP. Ours is over 100%. So they don't have nearly as much of an interest drag as we do. The second thing they decided to do was to roll back the regulations, because they recognize that a lot of regulations are counterproductive and really do more harm than good. So they rolled back the regulations, which I believe we also need to do, and I might give some examples of that later. The third thing they did is they cracked down on fraud. Those are the 3 things. We have not cracked down on fraud in the United States. We have looked the other way. Medicaid fraud in Minnesota, I estimate, is costing every taxpayer about $500 a year. And I'm not talking about people at the lower level that are making false claims. I'm talking about what the state of Minnesota itself is doing and what the HMOs are doing in overcharging the Treasury in Minnesota and the federal government. Okay? We have not had the will to crack down on fraud. Australia does. So if we did those 3 things, I believe we could have the economic growth that Australia has. 5%, not less than 2%. And that has to be part of the solution. But you have to have an economic development plan, which we don't have. So, but the big thing is we need to change direction. Yes, sir?
What kind of health system does Australia have?
It's a free enterprise system. I mean, they don't have
us.
Pardon? Yeah, like us before the new bill. Yeah. By the way, Obamacare, the last estimate I saw, which came out of one of the Senate committee research teams, is that Obamacare will add $2.6 trillion to the debt over 10 years. And that was just published about a week ago. It came out of the the Republican conference research staff in the U.S. Senate. And it's interesting how this number keeps getting bigger. Do we have $2.6 trillion that we can add to this debt? I mean, we don't have the money. Yes.
How are you going to solve the health care problem? And just leave it the way it is, or what?
No. There are a lot of things we have. There are a lot of things we have to change, and it's not just any one thing. But let me start with law changes on malpractice suits. There are some estimates that the malpractice, boondoggle, is costing close to 20% of our medical costs nationwide each year. In Minnesota, let me be explicit, in Minnesota, if, as an example, there's a childbirth and, God forbid, the baby is born dead, which does happen, that is, for all practical purposes, considered malpractice, whether or not the medical community did everything they possibly could do. We need law changes so that you have genuine malpractice, not bad outcomes. In that kind of case in Minnesota, I mean, the insurance companies aren't going to contest it. They will just pay.
How many cases are there like that in Minnesota? You're kind of making a big deal out of.
Well, there are enough so that you have massive defensive medicine. Personal example.
How many?
Well, let me just say that there was an organization out of the state of Washington that studied it extensively 2 or 3 years ago.
In Minnesota?
Well, nationwide.
Oh, we're talking here.
Well, you're talking
about here.
I'm talking about federal office and in terms of what we need to do for medical costs across the country. Let me give you a personal example.